Welcome to Saturday, Caturday. I hope everyone's having an awesome weekend. Sorry about the small delay. I had to somehow manage to crunch what would be a 25-hour course, 26-hour course into less than 24 hours. So, yeah. And that's what I've been doing yesterday and today. Thankfully, we managed to get through that on the first try without a hitch. Today, maybe, depending, we might get a visit from the co-host, who has been a bit under the weather. So that's why she hasn't been here yesterday. Last weekend, and we'll see if she is able to hang out with us today. We've just got a little bit of news and a little bit of and games, because of course it is Saturday. So let me go ahead and start getting some of that up. And of course, there will be an obligatory kitty cat, so don't worry, guys. In one way or another. So there have been some people who are confused as to how the CDC has updated its guidelines in regards to the updated mask guidelines. So we're gonna try to dispel some of that, okay? Alright. CDC is urging local health authorities to consider heightened prevention strategies like universal masking for public indoor settings, particularly when it comes to large indoor gatherings with travelers. It cited new data from a Delta variant outbreak in Massachusetts that led to hundreds of coronavirus infections, many among the vaccinated travelers. Hey, Memmius, how's it going? Making fresh coffee just in time. Memmius. The CDC and the agency's Morbidity and Mortality Weekly Report also published more details about the pivotal discovery that prompted federal health officials to ramp up their masking guidance. Earlier this week, tests used to diagnose cases to the Massachusetts outbreak had similar cycle threshold values among both the unvaccinated and fully vaccinated breakthrough cases, suggesting that both groups could be carrying similar loads of the virus. In other words, the folks who are vaccinated originally were thought, at least this is what's happening with this Delta variant, were thought to be less transmissible, which normally it would be. However, this Delta variant has kind of thrown in a wrench in that one, and they are now discovering, based on, this is going to shock you, but based on new data, new science, that it turns out for this Delta variant, the vaccinated folks can also be carrying similar loads, which is higher than anticipated, which is continuing to perpetuate this pandemic, even if the folks who are vaccinated aren't really getting hospitalized or anything like that with any serious illness. It's still helping this pandemic continue, right? High viral loads suggest an increased risk of transmission and raise concern that, unlike other variants, vaccinated people infected with Delta can transmit the virus. So this is new information as they evaluate the situation with the Delta variant. And of course, because of that new information, CDC guidelines were updated. We've talked about this in numerous occasions that if you want to avoid all this, if you're tired of the mask, if you're tired of any potential lockdowns, if you're tired of the pandemic and just want things to get to normal, you have to listen to the science, get vaccinated, wear your mask, whatever updated CDC guidelines are. It's there for a reason. Okay, you unless there's like some magical virology degree or epidemiology degree that granted you decades worth of knowledge, I would defer to the folks who actually know what they're doing, right? This finding is concerning and a pivotal discovery leading to the CDC updated mask recommendations, which is why they do these things. The scientists who authored the report published Friday that their findings amounted to crude correlation to transmissibility and cautioned that microbiological studies are required to confirm these findings. Beyond merely measuring the amount of virus someone is carrying, scientists would need to confirm the risk by culturing live viruses from a specimen, a spokesperson from the Massachusetts Department of Public Health told CBS News. However, the investigation's findings added to a growing body of evidence that spurred federal health officials to ramp up their guidance to curb surging cases of the Delta variant around the country. Yep. In Provincetown, CDC researchers as well as local and state university scientists and investigators have turned up 469 cases of COVID-19 among Massachusetts residents who traveled to Cape Cod destination starting on the 4th of July weekend. A total of 346 of those cases, or around 3 in 4 patients, were fully vaccinated people. A majority of those had symptoms, and nearly all had that Delta variant. However, no deaths were reported, and only 5 were hospitalized, suggesting that the vaccine's goal of reducing the severity of the disease still remains successful. Yeah, here's the issue though. There is mounting evidence to suggest that this so-called Delta variant is being incredibly problematic, and what happens when it mutates again, right? So I mean, the best way to deal with it, I think, is just to encourage people as much as possible, in as many numbers as possible, those who are eligible to get the vaccine, to please get vaccinated. Just as simple as that. Just as simple as that. So once again, as a public service announcement, if you haven't already done so and you are eligible for vaccine, please go and get the vaccine. Yeah. An internal document within the agency recently urged health officials to step up their warnings around the virus, acknowledging that the war has changed in light of new highly contagious Delta variant. Nationwide, with the Delta variant now estimated to make up nearly all of the circulating virus in the US, the average pace of new cases has climbed to rates not seen since mid-April. Yeah, we're sliding back in a sense, yeah. Walensky warned members of Congress on Thursday, according to a release from a House subcommittee, that hospitalizations have surged to levels beyond the peak of summer last year. Yeah, so this is where we're at, folks. Oops. The new data also comes as Public Health Agency had come under renewed criticism for not having released the data underlying its shifting guidance earlier this week, apart from vague references to the figures in press conferences and online posts. So it seems to me here that the main criticism is the method of relaying this information, which there may be an argument for. I'm not sure. The reality is, like, so one of the issues is the way information is being relayed, and it's causing problems, right? I think that if you're in a position of authority and you're in a position of power, then what you say and how you say it matters, and all of these officials and experts have a responsibility to make sure that they accurately and effectively, more importantly, accurately and effectively transmit this information to the public. Otherwise, it gets lost. Otherwise, it gets lost. Hold on, folks, give me 1 second. Seems like we may have a tiny bit of an issue, but that's okay. Hey Rumham, how's it going? It would probably be better to be publicly ridicule crazy conspiracy theories. If you believe Bill Gates is trying to put a microchip in you, you should be laughed at. Yeah, but I think that those type of people were so far gone that they're literally believing that there's like a giant conspiracy to like inject microchips in people. I'm not sure you're gonna get those folks, but there are folks who are skeptical and in a obviously in an unreasonable way, but I'm not sure that that would be the approach that I would take. The only thing you can do is show them why their concerns are not founded in reality. I acknowledge that, you know, okay, look, I get it. However, the reality is X, Y, and Z, right? And at that point, if they want to accept that, that's on them. But we must try to get as many people to live in reality as possible, right? We gotta do our best to try to get as many people on board with reality as possible, just for the sake of, you know, everybody's public health, right? I know it's like ridiculous that at this point, like, this is where we're at, but okay. This outbreak investigation is one of many. CDC has been involved across the country, and data of those investigations will be rapidly shared with the public when available. I think that's probably the best thing. Like, honestly, as information comes in, the relevant information comes in, it should be relayed as best as possible to the public. I would even argue that maybe they should have, not necessarily the press secretary do this, but like maybe the CDC director themselves should be at the head of these conferences. I'm not sure, but something to make sure that people understand that this is legitimate and that people will listen to. Wondering if Republican donors are starting to put pressure on right-wing media outlets and politicians to take COVID seriously. Some on the right have started to change their anti-vax stance after the market dropped around a week ago. Yeah, that may be a coincidence. It could be explained by that, but maybe that is a factor. Maybe the other factor is the reality that, you know, the folks who are unvaccinated are... the reality is that folks who are unvaccinated, generally speaking, not all, but generally speaking, overwhelmingly are conservative. They're realizing that it's actually them that are being affected. Maybe a combination of these factors, because it was impressive to see that 180 turn. Sean Hannity, Ron DeSantis, even though he's going around trying to block municipalities and cities from issuing mask mandates, but even he said vaccines save lives. Impressively, Sarah Huckabee Sanders was out there saying to take the quote Trump vaccine. So, hey Darknet, how's it going? So yeah, it's very, very interesting to see the complete 180. I think Mitch McConnell also made a speech on the Senate saying to be reasonable and take the vaccine or something to that effect. I mean, they must know, you know? There is. It's called reality. Reality. In other worrisome news, Biden to allow the eviction moratorium to expire Saturday, which is today. This is potentially going to be a massive problem. A massive problem. The Biden administration announced on Thursday will allow a nationwide ban on evictions to expire on Saturday, arguing that its hands are tied after the Supreme Court signaled After the Supreme Court signaled the moratorium would only be extended till the end of the month. The White House said President Biden would have liked to extend the federal eviction moratorium due to the spread of the highly contagious Delta variant of the coronavirus, but instead, Biden called on Congress to extend the eviction moratorium to protect such vulnerable renters and their families without delay. Of course, that never happened. That never happened. They failed to reach any type of legislative solution. So now this is going to put a lot of things up in the air, right? I mean, what is the impact of what 3 point something? 3 point. The article does say 3 point. As of July 5th, roughly 3.6 million people. So yeah, that's gonna throw a lot of things up in the air when you put people in this position. Not good. Right? Yeah, sorry, Rumham. Unfortunately, the Supreme Court has made it clear that this option is no longer available. Elections have consequences. Elections have consequences. Aides to the Senate Majority Leader Chuck Schumer and Senator Sherrod Brown, the chairman of Senate Committee on Banking, Housing, and Urban Affairs, said that the two are working on legislation to extend the moratorium. Democrats will try to pass a bill as soon as possible and are urging Republicans not to block it. Lamau. In the House, a bill was introduced Thursday to extend the moratorium until the end of the year, but the prospect of a legislation solution remained unclear. Spoiler alert, they didn't figure it out in time. Oh yeah, and they're now hanging out in recess, I believe. If I'm correct. They failed to meet the deadline before recess. Absolute clown show. The court mustered a bare 5-4 majority last month to allow the eviction ban to continue to the end of July. One of those in the majority, Justice Brett Kavanaugh, made clear that he would block any additional extension unless there was a clear and specific congressional authorization. So, knowing this, why would the Biden administration put its hopes on what? Trying to extend it again instead of urging Congress, because he said there needs to be a clear and specific congressional authorization. The pressure should have been on Congress, right? The Biden administration's job at that point would be to pressure and get light a fire under Congress's ass to get something done. That was the responsibility of the Biden administration after that last ruling, saying, especially someone like, especially knowing that the Supreme Court is not going to rule in their favor. Why wouldn't you put as much pressure, political pressure, as possible on Congress to make sure that they can get something done or have a solution by then? This is unbelievably, completely asinine. I had some hopes when Biden was elected, but not ending the filibuster and passing voting rights is unbelievably crazy. Well, like, the thing is, I know that some people may have, and of course, I always want, the president to do the right thing, always, because, well, it benefits everybody, right? Whenever good legislation or good leadership is there, it benefits everybody. So, of course, I always want the president to do the right thing, but we also have to be realistic as to what we can expect from someone like Biden, right? I mean, one thing is clear. It is, and I say this with a grain of salt, it is definitely marginally better than a second Trump presidency, but at the same time, that being said, you were put in office by an enormous effort on the basis of delivering true solutions to some problems, right? Those key big campaign promises, you've got to deliver on. You've got to, and failure to do so will end up being even further detrimental, right? Because, well, guess what's going to happen in the midterms and consequently in 2024? We've talked about this before. By the end of March, 6.4 million American households were behind on their rent, according to the Department of Housing and Urban Development. As of July 5th, roughly 3.6 million people said they faced evictions in the next 2 months, according to the U.S. Census Bureau of Household Pulse survey. Dr. Rochelle Walensky, the director of CDC, said in June this would be the last time the moratorium would be extended. When she set the deadline for July 31st. It was initially put in place to prevent further spread of COVID by putting people out in the streets and into shelters. Housing advocates and some lawmakers have called for the moratorium to be extended due to the increase of the coronavirus cases and the fact that so little rental assistance has been distributed. That's also another thing that's just like absolutely beyond me. How the way they went about this solution was completely low effort, I would say, right? Where is the real aggressive rental assistance, right? There are some folks here who haven't been working for almost a year, maybe even more, right? And are about to either get hit with what, all of these past rent that's due, or face eviction, which obviously if you haven't been working because of the pandemic this entire time, you're not going to be able to produce months and months and months worth of rent. Chances are you're going to be evicted, and there's a lot of these eviction cases that have already been starting even beforehand that are just kind of being waiting in the court, right? As soon as this moratorium expires, then all of these cases are going to start happening, right? To the tunes of millions and millions of people. So yeah, the idea that there would be no serious, robust rental assistance is irresponsible, right? Irresponsible. Completely backwards way of handling things. Congress has allocated nearly $47 billion in assistance that's supposed to go to help tenants pay off months of back rent, but so far only $3 billion of the first tranche of the $25 billion has been distributed through June by states and localities. Some states like New York have distributed almost nothing, while several have only approved a few $1,000,000. What exactly is going on here? Like, how did we drop the ball so hard? Like, we needed to do, like, the first thing that should have been figured out is how to do this, right? The first thing that should have happened is how we can provide aggressive, robust rental assistance, right? The first thing that should have happened. Meanwhile, we're in, what, July? All of this has expired. All of these moratoriums are expired, and only, what, a handful of relief has been dispersed. What's going on here? Why was there a failure to really get this assistance that's so desperately needed out there? But meanwhile, you know, free corporate handouts like that seem to have absolutely no problems getting into the hands of those that didn't need it. Rumham with the 1 biddy. Thank you so much. Hey, Heat, how's it going? Right above you. Rumham. Howdy, howdy. The confluence of the surging Delta variant with the 6.5 million families on behind on rent and at risk of eviction when the moratorium expires demands immediate action. Yeah, no kidding, said Diane Yentel, executive director of the National Low-Income Housing Coalition. The public health necessity of extended protections for renters is obvious. If federal court cases made a broad extension impossible, the Biden administration should implement all possible alternatives, including a more limited moratorium on federally backed properties. I mean, sure, if that's within his purview, he should do whatever he can. Gene Sperling, who is charged with overseeing implementation of Biden's $1.9 trillion coronavirus rescue package, said it was key that states and local authorities speed up the rental assistance distribution. Yeah. The message is that there's no excuses. True. States and cities across the, Mammy is gifting a tier 1 sub to Darknet. Thank you so much. I appreciate that. Thank you. So kind. States and cities across the country have shown these programs can work and they can get the money out of the door effectively and efficiently. The fact that some states and cities are showing they can do this efficiently and effectively makes clear there's no reason why every state and city shouldn't be accelerating their funds to landlords and tenants, particularly in light of the CDC eviction moratorium. The trouble getting rental assistance to those who need it prompted the Biden administration to hold several, thank you.
Please clap.
The trouble as getting us rental assistance to those who need it has prompted the Biden administration to hold several events in the past month aimed at pressuring states and cities to increase their distribution, coax landlords to participate, and make it easier for tenants to get money directly. Associate Attorney General Vanita Gupta has also released an open letter to state courts around the country encouraging them to pursue measures that would keep eviction cases out of the courts. On Wednesday, the Consumer Financial Protection Bureau unveiled a tool that allowed tenants to find information about rental assistance in their area. Despite these efforts, some Democratic lawmakers have demanded the administration extend the moratorium. I mean, like, yeah, he can try, but the courts have already said they're gonna say no if it gets challenged in court. The pandemic is not behind us, and our federal housing policies should reflect that stark reality. With the U.S. facing the most severe eviction crisis in its history, our local and state governments still need more time to distribute critical rental assistance to help keep a roof over the heads of our constituents. Again, knowing this, where was the necessary necessary action behind it? I mean, like, I don't get it. It's so frustrating. I was trying to pay you back, but it wouldn't let me, so Darknet was the next one on the list. How kind. Paying it forward is better anyway. It's true. True. Democratic U.S. Representatives Cory Bush and Jimmy Gomez of California, Ayanna Pressley of Massachusetts said in a joint statement. But landlords, who have opposed the moratorium and challenged it repeatedly in court, were against any extension. They argued that the focus should be on speeding up the distribution of rental assistance. This week, the National Apartment Association has several other weeks. This week filed a federal lawsuit asking for the $26 billion in damages due to the impact of the moratorium. And the extension of the eviction moratorium equates to an unfunded government mandate that forces housing provider to deliver a costly service without compensation and saddles renters with unsurmountable debt. Yeah, yeah, it's kind of like kind of really exhibits a whole, right? A very, very, very big problem here, right? Adding that the current crisis highlights the need for more affordable housing. So, if that's the case, I wonder if they would be in favor of some type of, like, rent cap, like, rent, limiting legislation where they can't go above a certain amount. You know, for affordable housing purposes. If only my labor had a super PAC. Well, there is such a thing. Well, not a super PAC per se, but a union would be the I guess relevant analogy. Okay, folks, it looks like maybe the co-host will be joining us. Let's see. If only we had more unions. I agree. No, I agree. Unionization is abysmal in this country, and I think that it would be a good way to even the playing field, right? A good way to even the playing field. If they have massive undue influence with their if they have massive undue influence with their money, well, you can balance that with massive unionization and collective bargaining. All right. Our nation faces an alarming housing affordability disaster in the horizon. It's past time for the government to enact responsible and sustainable solutions that ultimately prioritize making both renters and housing providers whole. Sure. I think that the best way to do it, to be quite honest, is to expand public housing. And the way you do that, different ways. But one of the ways you can do that is by making large governmental programs to buy these abandoned buildings or abandoned apartments or abandoned houses that are just sitting there, collecting dust, essentially, and make housing programs so that people can become homeowners, or make housing programs that are temporary reliefs that give people the tools that they need, and that can come in any of those ways, in my opinion. Jesus. Hey, Elio. If the tenants, renters have the sheriffs before the court evictions, I'm not sure what that means. I think that that won't happen until a moratorium is approved by the a eviction is approved by the court. Then the sheriff will come to, quote, enforce that moratorium. I mean, eviction. Jesus Christ. Alright, folks, dozens of House Republicans, staffers march maskless in a childish temper tantrum. It's the only way I can explain that. Ah, yes, okay.
That congressional staff and visitors who do not comply with the new mask mandate could be subject to arrest. Congressional correspondent Chad Perg.
Okay, so I think this is a misconception. I'm gonna have to double check that. I think that what it is that if you are on the premise and you are not wearing a mask, you'll be asked to wear a mask. If you do not comply, you'll be asked to leave. If you do not leave, that will be trespassing. If you're trespassing, you're subject to arrest. That's the order of operations, if I understand. It's not because you're being arrested for not wearing a mask. So I think that may be a misconception. I'll have to double check that. On TV talking about with SWAT TV themed. And wait, do you have a link for that? Can you please send a link?
Chad, what do we know?
Good afternoon, Sandra. Well, Fox obtained a memo from brand new Capitol Police Chief Tom Manger. He just came on board last week. Manger writes the Capitol Police officers on the House side of the Capitol shall enforce the mask mandate indoors. If staffers or visitors don't comply on the House side, they will be asked to leave. Otherwise, they would be, quote, subject to arrest for unlawful entry.
Right. Okay. So yeah. So you're not being arrested or not wearing a mask. you're being arrested because you are being asked to comply with X, Y, and Z. You're not complying with X, Y, and Z. You're gonna be asked to, leave. And if you do not leave, then you'll be considered trespassing. As simple as that. So yeah, I don't know. Like, the framing of this is just wild. Nailed it, yeah. MTG. Yeah, just link it to us here on the chat, Elliot.
This enraged House Minority Leader Kevin McCarthy.
Big mad.
If a vaccinated staffer comes across in the House side without a mask, you are ordered to arrest them.
That's
But
not.
on the Senate.
Wait, that's not what they literally just said. Wait, that's literally not what they just said. And furthermore, House rules are different. Wait. House rules are not the same as on the Senate. If the Senate Majority Leader decides to implement X, Y, or Z rule, that's on them. That's not going to affect the House. Why would you even... How is this guy in government and he doesn't even know how his own, like... He's the Minority Leader and he doesn't know how this works?
This is not the America we know. This is not Pelosi's house. This is the people's house.
Wait. Buddy? Indeed, it is not Pelosi's house. Indeed, it is the people's house, technically. But, as Speaker of the House, as elected Speaker of the House, she sets the rules as to how things go there in that particular area. Just like the Senate Majority Leader sets the rules on how the procedures and rules work within the Senate chamber. I mean, this is elementary. This is elementary. But he does know. He thinks we don't know, and he's right oftentimes. Well, sadly true. But, I mean, come on.
McCarthy and other GOP members also tore into Capitol attending physician Brian Monahan. He is requiring masks in the House, but not the Senate.
Jesus Christ. Dozens of House Republicans and their staffers marched maskless out of the House to the Senate floor in protest of the new mask mandate for the lower chamber. Lawmakers and their staffers traveled across the Capitol on Thursday to protest the fact that Capitol Police have instructed officers to arrest staffers and visitors who don't wear a mask and refuse to leave the House. See, that's the key. That's the key right there. Refuse to leave the House. Prior to the migration, Representative Chip Roy, of course, motioned to adjourn the House in protest against the mandate that Republicans have said come down from Speaker, have said that came down from the House Speaker Nancy Pelosi. Yeah, because she dictates what happens in the House. Yeah, it's kind of how that works. Just like you will have an opportunity to dictate what happens in the House should they win the midterms, right? Not that it's a good thing, but it's quite honestly most likely what will happen. And if so, then they will get to set the rules, which they will gladly do. They will gladly do. If they're the ones in the position of power, they will do that. I mean, alright, let's watch this clown show. So brave. So brave. Look at these. Look at these. Brave clowns. Send in the clowns. It's a nice PR stunt for the base. True. How many of them are even vaccinated? I'm sure there's some that are. Okay, we got the co-host, I believe. Let's see. Howdy, howdy.
Well, I
Howdy.
tried to get a cat.
Oh, well, the cat's there.
He was. He ran.
He ran.
He ran.
No.
He ran for the hills.
Hold on.
Or ran to the hills?
Yeah, I think it would be
How-
to the hills.
How does the song go?
Howdy, howdy, howdy.
Oh. Whew.
Did you change the little, duder?
I took the one off the Samson and put it on top of the one that was already on there.
Oh, yeah, so, okay, good. You did the exact same thing. Nice. Hey, it works.
Yeah.
It works. Howdy, howdy. How are you feeling?
I'm still breathing.
You're still breathing. Well, that's step one. Step one is that you're still breathing, so that's good.
I missed you all last week. I could not even speak really too much at this point last weekend.
I mean, you sound like you're kind of there.
I sat on oxygen for about 45 minutes
Jesus Christ.
before I called you.
Oh
to
my
Try
God.
and get my O2 levels up a little bit so that I won't run out of air too quickly.
Yeah, yeah. You know, I mean, if
That's right, Mimius, Iron Maiden. I had the privilege of running lights for one of their shows
nice.
when they came to Miami. Thin Lizzy, Black Label Society,
Ooh, nice.
and Iron Maiden. It was a fantastic show.
Mm.
I'm
That's
sorry,
right.
I'm probably gonna cough a lot, guys. I'll try and turn my head, not cough into the microphone.
I bet most are vaccinated. They're just playing the anti-vax character for the base. True. Well, I mean, like I said, I'm just glad that you're okay, and I hope that the upward swing continues. Jesus Christ.
Oh man, it was a scary week.
Yeah, a scary week. Not a day, not a couple days.
Week.
A week. Jesus Christ. Well,
This has been an experience for sure. I've had pneumonia before. I've had bronchitis before. I've had sinusitis before. I have never had all three at one time.
nah, it's something else. Jesus. Ooh.
I
mean,
knew when I went into the doctor and he put the stethoscope up to me and he's like, I'm going to take a quick listen. And I saw the look on his face. I'm like,
Yeah.
I mean, I'm not a doctor. I'm not a nurse. I'm not in the medical industry whatsoever. But I have had health issues my whole life. My mom and my sister both have had breathing issues for both of them their whole life. So I'm pretty familiar with what is going on.
Yeah, yeah,
And
yeah.
I knew originally, okay, this is a sinus headache. There's no chest congestion. And then the next day I woke up and all of a sudden, you know, I could hear my bronchial tubes were super congested. I'm like, all right, bronchitis, I can deal with this. I've been getting it every year. I'm pretty sure I have what they call chronic bronchitis.
Yeah,
which
yeah, yeah.
At a certain point, it keeps coming back,
Right.
unfortunately.
That would be
But-
the chronic, yeah.
Right, but then my family left, and the day they left, my chest was getting worse, and I got my stethoscope out, and I was listening. I'm like, all right, this isn't just bronchial tubes that are clogged up. I'm congested throughout my entire system in here.
Jesus
And I could
Christ.
hardly even hear my heartbeat over my lungs wheezing, which the doctor said the same thing.
Right, which is indicative of whatever. Like, I'm not a doctor, but like, which I assume they perceived as indications of, the other thing to diagnose. You said bronchitis.
It started off with probably with an ear infection, because if you remember several weeks ago,
you know
I was
what?
having I was
Yes.
having like a weird thing with my ears,
Yes.
and I thought it got better, but it's the thing about being somebody who lives with chronic pain every day. What might be miserable to some of you is something I may not even notice.
Right.
I hate to say it like that, and I don't mean it to sound,
No, it's just that, like, people.
that's just how it is. How it is.
Yeah,
I do not have any memories. I was so young when I started getting sick. I don't have really memories of what it felt like to not be in pain.
Yeah, so this is common. I think if you ever see them around in chat, Kazbox, Alex has described it similarly in terms of, like, what seems normal to them or what seems just like the daily is like
Right.
completely
So, like,
a world of difference.
So, like, one of the symptoms for me, a big one that comes with my illness is fever. I have fevers randomly all the time. So this whole COVID thing and people checking temperature,
Oh boy,
good
that makes
thing I don't go anywhere.
nice man.
And I even said that to the doctor. It's like, oddly, I haven't had a fever since I've been sick at all. So it's like my body wasn't even fighting at all. It was just like, okay, here you go. Bacteria's here. We're taking over.
Yikes. Where are we on the Noog Wrangler? Where are we on the yard sign debate? I think yard signs are based, and I think everybody should have a yard sign, because yard sign changes people's mind.
I love when we're on a Jeep ride in the middle of the freaking mountains. And I'm sorry, hold on.
Is that the Majority Report background? You could say that.
And we might pass a cabin and they'll have a big sign out front of their house that says honk for Trump.
Honk for Trump.
Oh, there's like 500 Jeeps, and I hate to say I'm not the majority here. Most people here are not.
Oh no, so it started off a chorus? Oh no.
They're not like me.
Oh,
So, me, I would honk just to annoy these people and disturb their peace and quiet, but everybody else, thinks there's solidarity.
Yeah.
Either way, I honk.
That's funny. What is that the Majority Report?
I hope I make them drop a cup or something,
Is that the Majority Report background? One would say it might even be better. It might be even better than the Majority Report's background. I don't know. You guys might be able to make a determination on that. I'm sorry to hear that, Bree. I have chronic pain too. Makes life interesting. That's one way of putting it.
It sure does.
My
so
yard-
like me, you get fatigued easier. You get muscle pains and body aches and stuff like that. So just based on the symptoms that I might feel on a daily basis, some people would think I might have the flu or something, and that's not the case. So I always have to be very clear when I go in, like when I went into the doctor, to make sure, you can't be using these as determining factors for what's wrong with me. He basically just went off of listening to my chest, and me explaining everything that happened. I didn't even realize about the whole earache turning into the sinusitis thing that was what started this until after I left. And I think I texted you. I'm like,
And you know what?
that's
There
where
might
it
be
all
something.
started.
Yeah, because like eyes, ears, nose. Eyes. Sorry, I'm getting all this confused. Ears,
Ear, nose, and
throat.
throat.
Yes,
ENT.
is yes. is all in Spanish. It's called otorrinolaryngologo, which is whatever doctor is for all of that. So all of that is interconnected. So it's not really far-fetched to think that it could be from an ear infection that all of a sudden went super south, like really bad.
It did. That's what happened. The ear infection turned into rhinosinusitis, and then that migrated to my upper chest, to my bronchial tubes, and became bronchitis.
Yeah,
And from there, it went further down and turned into bacterial pneumonia.
Jesus Christ, that's
fucking
like
great.
Horrifying. Like
this is the most I have talked all week, to be honest with all of you.
wow. I mean, like
I've been communicating with everybody with text because
right. So in case like
even on the phone yesterday, I couldn't get one whole sentence out.
Right, like I was telling folks yesterday, sorry, like the reason why I was like paying attention so much to the phone was because I was seeing like when you were gonna come on, if you could come on. But yeah, so
I got so sick yesterday.
Jesus Christ.
I tried because yesterday was the first day of me trying to take both antibiotics. Because and you know, anybody who's been sick before, they prescribe antibiotics. You're not really supposed to take more than one at a time.
Yeah.
But for me, I cannot go to the hospital. That's not an option. That is almost certainly going to be, you know, a sign of the end if that happens.
Right, and not only that,
I have to rely on my own limited knowledge and ability to take care of this at home. I'm very fortunate in the fact that I have oxygen machines here that I've been able to use. Most people do not have those. That's what you would be on if you went to a hospital.
Oh, that's right.
If anybody remembers back to any of the times I've shown off my glass studio, my pride and joy is my oxygen system that I built.
It just happened.
I took that bitch apart and I ran 2 of the oxygen generators.
Wow. I just put that together.
Up my respirator to it.
Yeah, I just put that together. I'm like, wait, how did you get oxygen? That's right. You have oxygen concentrators for your studio, which happen to be the same that are used in hospitals. Holy yikes.
So I've been lucky. I mean, I've been very lucky this week. I know that this week was a brush with death. I'm not afraid to admit that.
Jesus Christ.
It's been serious.
It really was. Based on like the communications you were telling me, holy yikes, dude. Like, honestly,
I mean, I've lost 14 pounds since Friday. Since last Friday. Anybody who knows about losing weight and exercising and stuff can chime in and tell you how unhealthy that is.
Yeah.
And how I'm basically was working against the fat buildup that I have, and that's what kept me going through being not able to eat. I was lucky this week to be able to eat. You guys seen those little tiny sleeves of club crackers that are like this big?
Yeah.
If I ate one of those in a day, I did good.
Jesus Christ.
And that's, from me, I'm used to a high protein, high calorie diet because of how active I am.
Yeah, and you eat pretty healthy. Like, you eat pretty, like, 99% of the stuff you do is just like either mostly or I would say above 50% from your own stuff.
Oh, of course.
Yeah, so you eat pretty healthy.
I ate a half an apple last night and I felt so good to be able to eat that, and it almost made me throw up, but you know, took me 2 hours, but I ate a half an apple.
Jesus.
And I was happy with that. That's the most I ate all week. It's been rough. I'm very lucky. I know I was complaining before, but I'm very lucky I put on as much weight as I did.
Yeah, well, I mean,
it ended up being my saving grace.
Your luck is more than your luck came from more than one. That's for sure. My yard says science is back. That's a good one.
Oh, I like that. That's good. I don't want to get shot though, so I'm not putting any yard signs.
So I'm not putting any yard signs. Yeah. If I see bad peoples, I go for the nose. Hey, that's no, Kevin, that's bad. Your background has a Bernie sign, so it's better. True. You tell Sam that, all right? You tell Sam Cedar that. I'm just glad that it seems
Today is the first day where I feel like I'm getting better.
that's good.
And that's 8 days. 8 days of every day was the same thing or worse. I can deal with a lot. I have had lots of hospitalizations. Most of my childhood was in and out of ICU. I mean, I've been through a lot, but this last week was a reality check.
Yeah, 1,000%.
It was
no doubt about it.
It was serious enough that I made sure that everything was in order.
Yeah,
this
because
last week, just
yeah,
in
yeah.
case. Because if I had taken a turn any further than I had, I might not be here today. I'm thankful. I've been struggling with depression lately, and it's hard to not be depressed when you feel like this, but even though I feel depressed, I also feel like I have a new look on life. Like, okay, I almost didn't get to keep going. Now I think I am going to get to keep going.
Now you have to.
We need to do full send here.
Usually when faced with that type of, scenario, I imagine that's a put your feet on the ground reality check on how on life, isn't it?
It is true.
What if I said I was starting a progressive TMZ show? A progressive TMZ. Are you gonna do like clips of like? Are you gonna drama clip all the drama segments of all the progressive Twitch streamers or YouTubers? Is that it? I mean, drama sells. Drama sells, Noog. Drama clips, yeah. You should call it, instead of poly clips, you should call it drama clips, right? There you go. I would just make shit up and pose it as a question. Jesus Christ.
Can I guest star on this?
Yeah, well, I mean, all of us do politics, so yeah, we'll be in the drama TMZ, in the politisphere TMZ that Nug Wrangler is gonna make.
I am about this.
Oh man,
I am about this.
Let's do it. All right, folks. So yes, as we were discussing, a lot of dozens of Republican lawmakers decided that they were going to throw a childish tantrum, not wear masks, and march themselves as if they were doing something brave. Clearly a PR stunt. Listen, folks, if we can just act like adults for a second, we would.
Oh, I'm sorry, that wasn't a joke.
No, no, it was not. If we could just act like adults for a second and like give her, just put our feet on the ground. How in Spanish it's pon los pies en la tierra, which is like come back to earth. Let's have a reality, let's come back to reality. Let's do what we need to do and get this pandemic over with. But instead we have leaders, congressional representatives, acting like children, parading around, crying victimhood because they were forced to put on a piece of cloth. That's literally it. Imagine crying this hard over.
So explain to me how these people can't breathe with a mask on, yet I've worn one every time I've gone out, and I have sinusitis, bronchitis, pneumonia, on top of asthma.
Right. Like
somebody explain that to me, please.
Yes. Yeah, especially someone like Tucker Carlson, as someone just mentioned. Explain to me, because he made the argument. Jesus. He made the argument that that putting masks on children is hazardous because of their something to do with the inability to properly ventilate or breathe. Like, I mean, come on, my dude. We know that that's bullshit.
There was one point yesterday when I was walking across the parking lot, and there were people. That's why I had my mask on. I'm not contagious according to my physician, but for me being a good person and just being extra careful, I was not going to go to the hospital and not have a mask on the whole time. Number
Right.
one, for my own safety. Number two, God forbid my doctor's wrong and I am contagious.
Yeah, like
Okay.
just as a courtesy, it's not even a big deal. Like,
So it was 96 degrees outside yesterday.
Jesus Christ.
I was walking across the parking lot. You can hear how I'm struggling to breathe even today just sitting here talking. Imagine 96 degrees. I'm walking across the parking lot. Walking is hard for me. It makes my whole body feel like it's burning because I don't have enough oxygen. You know what I did? I pulled my mask down and I breathed in through my nose and out through my mouth.
Wow. Amazing.
Ow!
I know, it's
Wow.
unbelievable. It's unbelievable.
I didn't die.
Yeah, I know. If you got a physician, you're an
Wow.
elite. No. Wait. No. Wait. You know that there's like physicians that operate on emergency rooms, and there's physicians which do not require any type of whatever. Like they have to treat you. They have
You
to.
guys, I went to urgent care.
Yeah, I was about to say, like, urgent care is also.
I don't have a doctor.
Yeah, so I don't know what that means about if you're a physician, you're an elite.
I don't have
no.
health insurance. I don't have a doctor. I don't have anything. I haven't even been to a doctor in several years because I've been able to manage my own health care, knowing myself and knowing what it is that I need. I don't have just, somebody I can call and say, hey, I'm sick, come to my house. Carlos and I scrimped together some savings to be able to pay for me to go
Yeah, so.
to the urgent care.
Yeah,
Because
so.
I had been out of work for a week.
If you have a personal physician, I mean, like. Do you mean like.
Everybody should have a doctor.
Yeah.
It shouldn't be a point of privilege to have a doctor, to be able to access healthcare
Yeah,
that
sure.
can keep you alive.
True. I mean, like, I guess he's saying it in the context of like the United States, because we don't have healthcare, a healthcare system. We have if you can afford it, then you're allowed to. But like, I don't know. I guess we're going to assume that what he means is if you have like the ability to have like a private on-call doctor in the United States, then yeah, maybe you would be considered a little bit privileged. But like the reality is, I mean, sure, I understand what you're saying, because
The reality is I wouldn't have been able to pay to go to the doctor if it weren't for, Carlos having set aside some funds from the stream. That's what, thank you guys, by the way. That's why I was able to go get help.
Yeah, actually, fun fact, that's literally what we that's literally
I
what
can
we
show
did.
you guys the conversation.
Yeah, so that's
I did not have the money to go to the doctor. That's why I had not been. That's why I got as sick as I got. Was
Health-
because I did not have the money to go, and I was trying to get better at home.
Healthcare in America is when
It
you
almost killed me.
healthcare in America is when you like use like streaming as a healthcare plan, or GoFundMe's as healthcare plans.
It's insane. It is freaking insane.
What is the difference between a personal doctor and a physician and family doctor? I think a personal physician is, from what I understand, because I literally just did a crash course, a 24, okay, so fun fact, I was just doing a 24-hour license renewal course for my insurance, because I do work with insurance. And part of that had to do with elective classes, and the elective classes that I did was about healthcare, because I'm very interested in knowing the ins and outs of the system. That allows me to have information which then I can use to be able to
I can explain this for everybody if you like.
to be that helps me to understand the system and why it's broken, and explain to people why it's bad. So a personal doctor, personal physician, from what I understand, is like a completely private like person you pay like on your own. No, that's different.
A physician is a medical doctor, either an MD or a DO, who has
Right.
completed graduate training to provide health care.
Correct.
Physician may be referred to a doctor, however, not all doctors are physicians. An individual with a PhD, such as a doctoral degree in economics, is referred to as a doctor. MDs generally focus on treating specific conditions with medication. DOs, on the other hand, tend to focus on whole body healing with or without traditional medication.
Yeah,
The
so
term generally refers to a person who has earned a Doctor of Medicine, MD, Doctor of Osteopathy is DO,
yeah.
or Doctor of Naturopathy, which is an ND, which is like my friend's parent.
Mm-hmm.
And these are all practitioners of medicines. All of these can be called a physician.
Okay. So those are physicians, and a family doctor is different. A doctor. Oh, I guess like for maybe I was viewing
No,
it.
because a family doctor would have an MD.
Got you. Maybe I was looking at it from
A
the
doctor
insurance.
is a physician.
Right. So I was looking at it from the insurance point of view.
A physician is a doctor. But for example, if you have a PhD in nuclear science, you're a doctor, you're not a physician.
Right.
Do you understand what I'm getting at?
Yeah, I was thinking of it in like insurance ways.
If you have a doctorate in a...
Oh, and it just crashed. It literally just kicked us both out. That's cool. It literally just kicked us both out. Nice.
No.
Excellent job, Discord. Excellent job. Anyways, as you were saying, sorry.
No, it's all good. I was basically saying that, so like, for example, if you go to college for 8 years and you get a doctorate in nuclear science, you're a doctor, right?
Mm-hmm.
Are you a physician?
No, not really.
No, because you don't practice medicine.
Correct.
If you get a doctorate in a medical field, you are either able to be called a doctor or a physician. It's interchangeable in that sense. In the medical field, it is an interchangeable term.
I see.
But a person who has a doctorate in a non-medical field is not a physician.
Gotcha. So you're speaking about like the little the definitions between these two things. I was thinking of it like the way insurance looks at it in terms of like your primary care physician versus like a family physician.
Well, PCP and elective doctors are different.
Yes. For insurance purposes.
That's a totally different thing.
Yes.
That's totally different.
Yes. Because you're a sensible person who has empathy for other people, Brie. True.
I just have common sense. It's not my fault everybody doesn't.
True. I mean,
I'm over here with no political affiliation. I'm not religious. I'm just a good old heathen.
You just, but like, you don't even have to like have any of this. Like, you don't have to have a political affiliation to look at like science behind why they would even refer you to wear a mask, or why they would refer you to have X, Y, or Z vaccination, or why they would refer you to have, oh, you know what, for this you need this medication, for that you need that medication. I mean, like, I know this is like a controversial statement, but like something like COVID or pneumonia or cancer or whatever disease or illness, and I know this is controversial, but it doesn't really care about your political or religious affiliations. It will screw you up, so it's up
to break it to everybody, but the only thing you really need to be concerned with is your morality. Your philosophy, your personal philosophy.
Yeah, because that what dictates what you believe.
Everything in your life will stem from that. I look at everything in an objective manner.
So what you're saying?
The best person I want to be. I don't want to intentionally harm other people. If I'm the best person I am, I can contribute my most to society. If I'm not intentionally harming other people, those people can be their best self and contribute the most they can to society.
Oh.
I think it is really a lot simpler than everybody makes it out to be.
Sometimes. But I think I think like, so what we're talking about stems from like your axiomatic, oh God, I forgot the philosophical terms. Your axiomatic, core or something like that. Basically, what you're saying is like people should like operate or should consciously operate out of these like axiomatic like things, and everything stems from that, which is, I mean, true. There's literally how like even I operate from basically my axiomatic beliefs, which is I want to do the most amount of good for the most amount of people. I believe that in order for, if you want to take the if you want to really make society better, then I think people deserve, or people should have, in order for them to be their best self, should have the tools granted to them so that they can be their best self, and that's up to them. And that should include food, housing, education, and healthcare. And if those people have these things, then what are then the chances of, you know, people using these tools and being their best self increases dramatically. So like, if you want to go about it that way, that is what I believe, and everything I talk about and I talk about it, and it revolves around that, right? Which me and the community and everybody has kind of like colloquially called it the 4 pillars, right? Because I believe that people should have these things, right? And I think that
I agree.
in whatever manner we can get it, I think that we should strive to make sure that people have these things as a baseline for society.
I would like to know why people think it's okay that I went to the pharmacy. One of the prescriptions I needed was $165.
165. What if you needed that to live?
I did, and I still do. I clicked on an app on my phone, and that prescription dropped down to like $40.
Jesus Christ. It's arbitrary. It's arbitrary. So in other words, if they can shave off a penny somewhere but the people don't know, then they'll inflate it.
It makes no sense. I could show you guys screenshots of what I would have paid for all these medications.
Yeah.
And I saved over $200 yesterday just on 2 prescriptions.
Mm-hmm. Yeah. Why?
That's
because it's
wrong.
arbitrary. It's
That's
arbitrary.
wrong.
Like in one place it'll be like 200, another place it'll be 40. Nice meme.
Why does it cost one price when I buy it from CVS versus costing another price when I buy it from Kroger?
Same drug. But 300 million people can have a dictator for being well, no, that's not how that works. Proud CIA asset. And actually, you're wrong about the masks as well. There's plenty of data to suggest that this is like borderline misinformation. Proud CIA asset. A mask, when worn by people, especially if you're all parties involved are wearing masks, have been shown to dramatically reduce transmission. At minimum, they reduce transmission by 30%. At maximum, if all parties involved are wearing masks, they reduce transmission like overwhelmingly, almost like, I believe almost 90% ish. So yeah, no, you absolutely should be advocating for mask awareness if you are in a high infected area, specifically whether or not you are vaccinated or not. This is just based on the latest CDC update. It turns out that vaccinated folks are showing that they have the exact same viral load as unvaccinated. In other words, we're realizing that the vaccinated folks are exhibiting higher levels of viral load than we originally thought, and it is uniquely related to the Delta variant, and we should be aware of that. So therefore, I completely push back on that. You should be wearing masks, particularly if you are in a highly infected area, and particularly if you're in a highly packed in indoor setting. And I also reject the idea that 300 million people can't have a doctor. If we're being realistic, it degrades medical quality. Also, we can't buy drugs over the counter without prescription.
Wait. So we all are supposed to have these doctors just paid for with private insurance.
As opposed to, right? Yeah, that makes sense. As
opposed to universal health care. That makes no sense. Number 2, I'm OSHA. Oh God, hold on.
That's okay.
I am OSHA certified in respiratory protection due to 3 different industries I've worked in. Do you know that cloth mask is more effective at protecting what comes out of your mouth than an OSHA certified respirator, which has no filtration on what comes out of your mouth?
Yeah, so the point being is like these small, even like the...
Not for nothing.
It's not for nothing. Even the useless, just like regular no medical grade cloth is still better than nothing, simply because it helps.
It's still better than an OSHA certified respirator.
It's like I don't know, dude.
Respirators do not filter exhaust. They only filter intake. That is one of the first things you learn when you are becoming certified to use a respirator.
Oh, wait. So you're talking about like the respirators that you use for work?
Yeah.
Interesting.
I could go downstairs and get one and put it on right now and show that much to you. I have one in my garage for when I work at home.
Jesus.
It does not filter your breathing out. It only filters your breathing in.
Yeah. So
that mask, that cloth mask, is still covering
something
from the spit and everything. You know, it doesn't get everything. I'm not saying it's 1,000% effective. Nothing is.
But it's certainly better than nothing, for sure.
You wear your seatbelt to keep you from getting ejected from your vehicle in case of an accident? Or no, because, you know, the seatbelt might hurt you too.
Yeah, oh, well, yeah, but the but the alternative is getting yourself yeeted off the window. So, like, there's obviously, reasons why they ask, oh, you're talking, oh, okay, wait, he's talking about something else.
An N98 is still a form of respirator. It has a filter that you breathe in through.
Gotcha.
I have N98 masks downstairs. I can go get some and show you. Got a filter that you breathe through.
Yes, the little filter things.
The cloth portion of a regular N98 mask will filter exhaust, but
So
not much more effectively than anything else does.
Right. So the problem is
there is no mask for that purpose.
The problem with the things is the little respirator things that have the little holes. That's a problem. My aunt is a nurse practitioner, has been treating a man that has COVID for 8 days now, double vaxxed in his 40s, not hospitalized, but it's still a really very bad case. Yeah, those are far and few between. Those are far and few between. It can happen. It can happen, but those are far and few between. Hey, Blue Lemon Panther, how's it going? Welcome. I'm talking about N98. Oh, wait, we went over this. The difference between... But there is a difference between respirators and that. Okay, yeah, true. So, yeah, I think we're just talking about two different things. The point is...
N98 is basically a cloth filter, a medical-grade cloth filter for the most part, that has a particulate filter that you breathe through. It's very similar to a respirator, and except for a respirator, you know, you're really not breathing out through cloth. It goes right out the center part.
Yeah.
I can get the mask and show you guys. It's got two big filters here. There's a little circle right in the middle of it. That's where your breath comes out. That's not very much filtered.
Yeah, so the thing that you want is something that covers your mouth and nose to reduce the amount of stuff that goes out. Because the whole point of a mask, why they use it in surgery, is because when you're trying to work in a sterile environment, you don't want to get anything out, right? So that's what I understand. So like people like, oh yeah, I was making this point. So people like Tucker Carlson who are going around saying that like masks somehow inhibit your ability to breathe. First of all, 100% nonsense.
Bullshit.
Yeah, we know.
I'm wearing one with 3 respiratory infections.
Yeah, which is...
and asthma. I have asthma.
So, obvious nonsense, but I was gonna say, like, hey, you know what? The next time Tucker Carlson needs a procedure done, make sure that his surgeon doesn't have a mask, because it might inhibit his ability to perform the procedure.
We wouldn't want him to pass out while he's operating.
We wouldn't want his surgeon to pass out while doing a procedure. So maybe Tucker Carlson should ask his surgeon about how good of an idea it would be for him to just remove his mask. Like, you best believe that this is all nonsense and Tucker Carlson would never do any of that. He's probably fully vaxxed and everything. But, you know, it just comes to, like, show, like, the amount of misinformation and problems it's causing. A lot of vaccinated people are getting the Delta variant. I think mask mandates are necessary. This shit's about to go down. I think so. I think that... the updated CDC mask recommendations are there for a reason, and they're backed by, of course, new studies. And like, I hate this framing of like, how some news organizations have reframed it as saying, oh, CDC backpedals, oh, CDC backtracks, or CDC flip-flops on masks, CDC, like, no, dude. Okay, so the way science works is that we believe something based on the plurality of data, and then if something comes along that supersedes that, then we change our or we should change our thought, right, on that. So if the plurality of data says the Delta variant does X, Y, or Z, okay, and then we get new studies based on new information, based on whatever, says that actually we have more serious problems with this Delta variant, then we should adjust accordingly. This is no different. This is how science works. It happens all the time. The only difference I think that people are having trouble understanding is that we're doing it live, right? We're doing it live. This is one of those rare situations in human history where we're literally doing this science stuff live, right? Because, well, it's an ongoing and fluid situation, and we've never faced anything like this, and of course things are changing on the fly, and it's because we get more data, and I'm sorry, but that's just the way it works.
You know why we never heard from Fauci when we had the Ebola outbreak? Because Obama listened.
Right, and like, it wasn't...
I hate to say that, but it's true.
Yeah, and it wasn't like a big deal. It was just like, oh, whatever. They took care of it. Because Ebola is something that we are knowledgeable about. We're comfortable in dealing with Ebola outbreaks. We're comfortable in dealing with, like, flu, an unusual flu season. We're comfortable with dealing with whatever X, Y, or Z. But this is unprecedented. So therefore, like, a lot of stuff is coming in fast, right? A lot of these updates are coming in fast in science terms, and it's just the way it is. And I think that people are like they're thinking way too hard, and they are just, by doing so, are inhibiting common sense prevailing. The CDC does flip-flop around the world. Flip-flop, all countries around the world have mask mandates since the pandemic. Only in the US, CDC can't even get the studies in time. Well, that's not because it's flip-flopping. It's because you just mentioned it. We have, like, in the sense of, like, information comes in incorrect times, maybe. I don't know. I'd have to double-check that. But you're just pointing out the reasons. It's not flip-flopping. It's just updating based on when we get that information, right? I mean...
Sent you a couple links. One is to a 5000 series P95 respirator, which is what I wear, and the other one is to an N95. And basically, an N95 is just a paper mask.
Mm-hmm. Yeah,
it's a valve with a valve for you to exhale vapors from your breathing.
Yeah, the problem is that valve. That's it.
The same valve that's on my N95. I mean, on my on my P95. So, just saying, y'all.
Yeah, no, these are different.
It ain't gonna work unless everybody wears one. A cloth mask is just as good as far as exhalation. It doesn't have a valve on it.
Well, yeah, because the cloth masks don't have valves in it. That's the problem.
If you look at the two I sent you, one is an N95, as one of our viewers mentioned, and the first one I sent is a P95, which is what I wear as a professional. And it's the same. It's basically the same valve. So you're not going to get an argument of one of those being better than the other.
No, I'm saying that the problem with these is exactly the valve. So it would be better to literally wear something that doesn't have one. I think, from what I understand.
I agree.
Government should have come in one day one and done mask mandates. Yeah, but they didn't. All right, we had the original administration who had this was the Trump administration, and it didn't happen.
But our freedoms.
Yeah, like, it didn't happen. So now we're here. Like,
I gotta run the dog out. I'll be right back.
It's incredibly frustrating, and it's incredibly, it didn't have to be this way, but right now, we have to deal with it, right? We have to deal with the consequences of incompetence, and the only thing that we can do is just listen to the science, right? It's just listen to the science. Whatever updated CDC guidelines is what we should be using, right? It's what we should be using as a baseline, right? So yeah, I understand. The Trump administration originally was the one who started dealing with this, and their incompetence has partially led us to where we are, right? Fauci said masks are not important, and then he said they are. Wait, he updated that information. Like, okay, so you're having this problem where you're stuck under like the previous information. So like, what, we shouldn't listen to the updated information when he said they were important? Like, I don't understand. As we got information that it was airborne, what, the mask mandates began to be effective. I don't get it. What's the problem? So because we got it wrong in one time, therefore we should just throw out all recommendations afterwards, even though updated science says X, Y, or Z. I don't get it. Okay, you may make a case for incompetence with the administration and their messaging. Okay, previous administration and their messaging. Okay, and we are here. The newest updated guidelines are X, Y, and Z. Therefore, we should use X, Y, or Z. I don't understand like why this is such a hard concept. That also isn't true. I live in Europe and we had the same information. Thank you, Human Capital Stock. I appreciate you giving us that information. Yeah, so I'm sorry, but like, you know what? I have a question for you. Real quick. Proud CIA asset, real quick. Do you like a caricature known as infrared? It has infrared. Trump said it himself. He didn't want to create a panic, so he had everyone lie for him. That's also true. America could literally suspend all freedoms in time of war. None of these patriots complain, but when there's a global pandemic where millions of people are dying, they can't put a piece of cloth over their mouth because of my freedom. True. Listen, so because I mean, like, I don't know. This sounds like some crazy, like, conspiratorial, like, line of thinking. Hey guys, doctors at one point were paid to lie about cigarettes, so therefore, I'm sorry, but like, I can't accept any, like, what? Like, hey, doctors at one point were paid to say that there was nothing wrong with cigarettes, so therefore we should never take medical advice. Like, what kind of, like, logic? It's basically what you're trying to say. At one point, science thought that the the sun revolved around the Earth. So therefore, like any updated information, I don't know, scientists, they seem to be incompetent. So I guess we just shouldn't like accept any updated. Like, what logic are you saying? I'm saying Fauci is incompetent and should retire. I'm sorry, Proud CIS. Did you happen to like magically acquire an epidemiology degree and acquired magically like decades of knowledge when it comes to infectious diseases? Like, I'm sorry, did you just like by osmosis like manage to grab all that information? Or also, real quick, do you like infrared? Are you an infrared fan? Retire from what? Probably, I don't know. I don't know what they mean. There are many virologists that can be better than him, just like the one who predicted how deadly it is, like Dr. Osterholm. I think he deserves this job. Oh, okay. I don't think Dr. Fauci said that this was not a big deal. I think he was very adamant about his about the seriousness of COVID. In fact, recently he has been saying, please understand this is worrisome. We're getting new data to indicate that this Delta variant is actually really problematic. Wear your mask, do what you need to do. These CDC guidelines are there for a reason. Yeah, I mean, I'm asking a serious question, Proud CIS. Did you manage to, by osmosis, obtain decades of epidemiologists, decades of experience when it comes to infectious diseases, and did you magically, like, obtain a epidemiology degree that made this possible, that made this determination possible? I just know infrared rays. I don't know, my dude.
I have a giant fluff ball on my lap.
Aw. Hey, Pip. I read it on Facebook, therefore. Yeah, I remember me getting my my virology degree on Facebook and Google University. If someone fucks up badly, you should be gone. We should never worship somebody. You just give the boss. Yeah. I agree, and that's why.
You have a better recommendation for who should do this job?
Yeah, he said Doctor Whoever.
In your infinite wisdom.
He said Doctor Whoever, but like I don't know like who would be qualified to make that determination. And furthermore, if he was so incompetent, that's really strange because he's been involved with like responding to like infectious diseases and all this other stuff from
not too incompetent for Ebola
for decades at this point. So I don't know, like his credentials like are fine. I think that like the criticism that are valid is like some of the ways his messaging was could be misinterpreted, and I understand that like there's issues with the ways information was being relayed. I think that you can make arguments for criticism like that, but like I don't know, I feel like you can't really attack the the credentials of someone. Don't put that on a difficult truth. You're just being offensive. True. If someone fucks up badly, you should be gone. Yeah, so like, I don't know. Trump should have been impeached within the first year. Yeah, well, he was definitely impeached twice, but you know, that didn't happen. He literally predicted how bad COVID was going to get. There was a lot of people who were predicting how bad COVID was going to get.
The problem wasn't with the medical professionals not telling us how bad it was going to get. The problem was with a certain percentage of our population feeling like them trying to warn everybody was them trying to, assert a communist regime in our country.
Right.
And you know what? I don't agree with a lot of things the government does. There are many things that I would speak out against openly. But you know what? We cannot blame the idiocy of a percentage of the masses on the government. Like, that's not how that works. Well, okay, that's a topic for another day, but it's not their fault people think that their freedoms are getting stepped on by them walking 6 feet apart, being courteous to others. If people wouldn't have been such dicks in the first place, there would have never even been a reason for the government to step in and do the mask mandates. But because people were such assholes, and they felt like they were being so infringed upon by being asked to wash their hands and maintain a good, respectable distance when out in public with groups of people, not to have large gatherings, because nobody could handle this common sense, yes, the government had an excuse to step in. And I'm going to say it just like that, because that's how I think of it.
Well, yeah, I mean, like, this is kind of like, you can't complain about like the government then having to step in when enough of the population are acting like children, and then like surprised when an authoritative figure has to step in and be like, all right, well, I mean, we have no choice here. It's literally public health. And furthermore, a lot of these like, well, Fauci, blah blah blah, like a lot of these are coming from, and I don't know, proud CA asset. Are you? Oh, hold on. Are you happen to be like a Jimmy Dore fan? Because like, holy yikes, dude, a lot of these like Fauci like nonsense is actually coming from Steve Bannon. A lot of these like, oh well, Fauci didn't say it was a big deal. Yeah, Fauci said that at the time with the information available, it was contained in China. He didn't. He said, quote.
He never said it wasn't a big deal.
Right. He said, quote. It is an evolving situation, and every day we have to look at it carefully. This was back then. In April, right? So a lot of these conspiracy theories are simply, hey Alio, thank you for the biddies. A lot of these conspiracy theories are coming from Steve Bannon, who was saying, oh, well, Fauci never said anything about this being a big deal, blah blah blah. Like, no, dude, that's not even correct. I don't know, dude. I feel like you're just saying like a lot of things without being like, without having like the credentials.
You have no facts to back anything that you're saying up.
Right. So
you
like,
are basically repeating just opinions.
You're repeating like Steve Bannon talking points. Like, I don't know. If you're a Destiny fan, like that's very interesting. Like he talks. I'm sure he goes like he makes arguments against this. Like, I don't know. Maybe I should like I don't know. I'm not going to speak for Destiny, but I imagine I would hope he's making arguments against like the type of stuff you're saying.
There are so many things that I would speak out against.
Yeah, sure. We all.
So many things. But the only reason our government got involved in this whole pandemic shit in the first place was because a very big percentage of people in our country could not have the sense themselves
Right. Here's
to be reasonable.
right, but
Is
here's
it being unreasonable during flu season to be careful, to wash your hands extra, to make sure that you're not going out in public and then touching your face or eating? Different things like that. There are so many things that we as a people, not me, not Carlos, not people who were paying attention and being cautious, but the people who felt like by them being asked to be responsible humans, that's not my problem. I'm not gonna get sick. I don't care.
right. It's not
what
me.
kind of attitude is that?
It's not a problem until it's my problem, as they say, as they're like right about to get ventilated, hooked up to a ventilator. Like, and the problem is, like, yes, you're right. A lot of people didn't have like the common sense to like take things seriously. But also, the Trump administration was very adamant about downplaying this at every single turn, and it's like at the beginning, which would have massively, we would have been having a different story had we at least attempted to have this, being taken seriously from the beginning. And honestly, a lot of that has to do with Trump, not necessarily like Dr. Fauci. So like, I don't know, this hard on for like Dr. Fauci is really weird to me, and like I don't know. I never questioned Fauci's knowledge, but I feel like he's incompetent for the job. And again, I was got 500,000 deaths, and you're defending a guy who presided over it with Trump out. Fauci should have stepped down too. Wait, that's not how that works. That's not how that works. The reason why he was kept is because he was doing his job. I mean, like, yeah, you know who had more of a hand about like putting us in the situation that we were in? The Trump administration. Right? We got 500,000 deaths. Why? Because we had a president who continuously downplayed it. We had a president who had choices in front of him as a president and opted to do none of those. Right? So like,
not a thing.
So I don't know. Like, I mean, like the only thing that he did positive that I will give him credit for is Operation Warp Speed. That's it. In terms of like what he did with the pandemic. So yeah, I don't know. It seems like this hard on for Dr. Fauci and like the medical field is like the professionals is like really, really weird to me.
I don't get it. I can tell when people are just spewing things they've heard from other places.
Yeah, sure.
Because
I mean,
there's just no argument to what you're saying at all.
Yeah.
You are literally parroting things that other people have said without any understanding to why you're saying what you're saying.
Particularly, I looked up exactly like what he's talking about how like Fauci like downplayed it from the beginning. This is a Steve Bannon talking point. This was a Steve Bannon talking point. Scientists and virologists don't prevent infections. They're only there to advise. Yeah, that's their job. Okay, sorry about the typing. No, it's all good. No, Trump made the vaccine. He told me so. Yeah. Listen, folks. Listen. For in the sake of trying to get as many people on board as possible, take the Trump vaccine. Do it. Do it for Daddy Trump. All right, he made it for you. I don't know, dude. At this point, I'm throwing Hail Marys here. Listen, Daddy Trump put all that resources into Operation Warp Speed for you. So take the vaccine. All right, do it for Daddy Trump. All right. At this point, I'm throwing all kind of Hail Marys out here to try to get people on board.
Oh my gosh. I lost enough people that I knew to this thing because of probably, I can't say for certain, but I will say probably because of selfish idiots.
Selfishness, yeah. It's,
you will never hear me back down against something that our rights are being stepped on. That's not me.
But
I will stand my ground and I will die on that hill. I don't give a shit. But this is not that hill. This is not a hill in the first place. It's a molehill.
Right, like relax. A face covering is not the end of like civil liberties. All right, relax.
I don't understand how 3 people out of 4 people in my household growing up have breathing issues. 5 if you include 2 of my 4 grandparents. Okay? Why can we all wear masks and not die?
Yeah, it's amazing that like a lot of like health professionals had to go on like TikTok and like literally take oxygen levels as they put on like 10 masks at a time to like illustrate the ridiculousness of people like trying to make the argument of oh well, masks inhibit breathing. They don't. Fauci, mistakes and all, was the most reasonable voice coming out of the lunatic administration. Many people didn't listen to Fauci because Trump didn't like him and created a campaign of hatred against him, just like he does with people who disagree with him. Yeah, the problem is because like the issue from the beginning, and I get it. People were like a little bit upset about how he like handled the whole like, oh well, mask here and stuff. Fine, the messaging was off. Great, I get that. But like also understand that like a lot of the Trump administration was spent like fighting with Fauci. Like a lot of it was spent contradicting what Fauci was trying to say, and then like there was this huge back and forth, and that created a lot of mistrust, and that created a lot of confusion. And so now we're here. Why do you think why do you think so many big countries are getting more and more right wing, like Japan? And well, Japan was, I mean, I think Japan is like, has always had a little bit of like a right wing tinge to it. Isn't that? Does that say? So is India. I don't know. Hey, Skiddedeer, how's it going?
Let's all focus on right and left. It's so good for us. It's helped us so much in the past.
I think at this point, like I've stopped like attempting to use at least for like a self-described. I've stopped attempting to use labels. Like sure, I can attribute things. I can attribute things to like right and left, and I can attribute things to like, for example, certain policies and whatnot, and certain groups, because I know for a fact that these certain groups align with left or right. But like, I don't know. I feel like for me personally, I think that like I'd rather be discussing about what my policies would do. I think that I would have a much more productive conversation if I told you what my solutions, what my prescriptive solutions to said problem would be, and then you make a determination of whether or not it's good. Right? So, like, if I say we have a healthcare problem, then I would say my prescription would be to try to implement some type of universal healthcare system, right? So, I think that you can judge for yourself, right? No one called you. Yeah, exactly. You're being quiet. You're being quite disingenuous by implicating him in some kind of conspiracy where I just asked for accountability and where his messaging was not good. Okay, but like, wait.
You're not giving any clear examples of what you're referring to. You are literally repeating talking points.
We addressed
from
it.
People who are totally against him, no matter what he does.
We addressed it. We said that there's some argument to be made about some of the messaging, but I mean, okay, yeah, and like I don't know. Proud Boy Enrique Tario is a CIA asset too. I'm not sure about that. I don't know if there's any evidence to that. Good point, Memmius. There is a accountability. Trump got voted out. True. I mean, Fauci recommended X, Y, and Z. That didn't happen. So yeah, there's some truth to that. I think that, like, again, I'm saying that what you're saying is coming off like of talking points that are like from like Steve Bannon and whatnot. Like, I don't know. I think that there are some legitimate criticisms of some of the messaging and how and the timing of some of the messaging. But like, I don't know. I feel like unless yeah, didn't the first thing come to help, and then he said masks were good. I mean, he should have told the truth earlier. Okay, so what you're saying is, because he didn't obtain information and because he used updated information, which we realized, holy yikes, dude, this thing is aerosolized. We need masks. Everybody should be wearing anything, literally anything. That's why he updated that. I don't get it. So what are you saying? So because he had problems with messaging at the beginning, because we were trying to still catch our feet with this ever-evolving fluid situation, I don't know what you expect. Like, so you're still hung up on the same.
That anybody can be mad at a medical professional who made many recommendations that fell on deaf ears. Instead, our glorious leader decided that he would rather tell us to use all these other things that had no proven efficacy.
Right. I don't get it. And like,
I
okay,
don't understand what you're getting at.
we're still stuck on this like mask thing. Okay, the messaging was off, and I get it. There's legitimate criticisms about like the messaging of how that happened. I get it, but that still doesn't change the fact that like all of a sudden we throw out like the rest of it with it. Like I don't know. Like we should just like get rid of him because of that. I don't know. There were mask mandates in China in mid-February. And that's a pivot. That's moving the goalpost, or that's a pivot. Whataboutism. And I don't understand. China is not the U.S. There's likely a number of reasons why people are hesitant to know. The first was being that they weren't 100% sure how the virus is transmitting, which I addressed. James Napper, I said that, holy yikes, this is aerosolized. We need to change the updated information as we realize that. I don't get it. Like, I really don't.
Here we go, a voice of reason.
I don't get it. Like, dude, I don't know. A lot of countries like Singapore explicitly wear masks in the beginning. Oh, cool. Even further, great, excellent, Blue Lemon Panther. Thank you. Anyways, TLDR, I get it, but that still doesn't like make me think that we should just like get rid of him, or that doesn't make me want to distrust him because of like maybe some fumblings in the beginning. I don't know. Like, okay. That's the TLDR of that. It just makes no sense because like
we're just gonna have to let this one go, Carlos.
Yeah, like we're going in circles.
We have attacked it with reason from every angle, and we've made a full 360. It ain't going nowhere.
I don't get it. Fauci may retire soon anyways. He might. I don't know.
Not for lack of trying.
Never.
You know, we just can't help everybody, guys.
Okay.
Fortunately, I feel like most of us were on the same page with this.
Yeah, and like the disorganization from the beginning, like this, I like cheese. Same. The disorganization from this at the beginning and the way the U.S. responded was like obvious. I mean, like we had individual counties in Florida mandating different things, and then like the state government still like not doing anything. So I don't know. It's just like it just depends.
Proud CIA asset has family in Singapore. What other countries do you have family in, so we can inquire about those too before anybody comments on them?
Right, and not only that, like I'm sorry, what country is this? Like I forget. But I think we also have to accept the first 2 to 3 months of 20 were canonical around the state really came out of it looking that great. Thank you. Like that's the whole point. Like we were trying to catch traction, which I made a point of saying. Like we were trying to catch like our
it was one big giant triage situation, and we did not know how to treat what was going on.
Yeah, and not only that,
nobody is understanding that.
Yeah, so I don't know. It feels like really weird to have like this hard on for like Dr. Fauci. I don't know. It just seems very, very weird. And I'm sure like even Destiny would agree that like it's just weird. All right.
What is it they say in that Frozen movie? Let it go.
Oh yeah. So hold on, folks. Let me
Oh, I wish I had pulled up a sample for that.
Do you like cheese? We got lots of cheese.
I mean, I'm named after a cheese.
Kind of.
Not really.
Kind of.
Not. I'm just kidding, guys.
Kind of.
So if you guys haven't already, feel free to check out that link that our bot just dropped in the chat for us.
True.
We are recommending a pretty good coffee company. Carlos and I both like it. And if you like coffee, you know, try some of this. It helps us out a little bit.
I hate it.
So might as well. Publix doesn't, you know. Do you know anybody that owns Publix or anything? Like, come on, guys. Look how cute we are. No,
seriously. To be fair, I've been trying out that coffee, and it's really, really, really good. And it's the same opposite direction. An example, I've seen a lot of Americans say Trump presided over a pandemic and made the economy worse in the world, which again is not true. There's a lot of people want to weaponize certain things to make their own side look bad. A pandemic is probably worse. It's probably the last thing we should be using for that. Set the bar higher. Yeah. Hey. Can we just like focus and
real issues we can control?
Other side. Yeah, and just like we are here. We are here. This is the situation that we're in, and current CDC guidelines say X, Y, and Z. Dr. Fauci explained why these CDC guidelines were necessary, and let's all be adults about it. Cool, excellent. I'm glad. Thank you for coming to our TED Talk. Let me send my. Okay, let me send a link to myself on the chat. Okay.
Trump was calling the ag rosin every day, telling him to adjust, say it was fraud, and leave the rest to me and ours. Someone said Japan is right-wing. Most of the Asian countries are right-wing because most of their citizens can't be left-leaning as they can't afford lot-free stuff due to colonization.
Yeah, colonialization. I'm not sure. I'm not informed enough to speak about that. I do know that it is true that a lot of Asian countries are generally speaking a little bit right-leaning, but I don't know if it's because of that. I don't know if it's not left-leaning because of X, Y, Z. I'm just gonna not say what I don't know. Can we talk about something important? Okay, that's a great suggestion. In fact, we've got something here that I think hold on, let me pull this up. Why is it? Where are we? Okay.
Yes, something important like Among Us.
Something important like Among Us. We do have one article that I want to go over. We do have one article that I want to go over, and it's something to like kind of address like where the thinking is in terms of climate change. Let me pull that up here. Let's see if it'll do what I wanted to do here. Sus, yeah, we'll play some Among Us. Hey. No. Ah. Cool. Okay. That being said, the Alaska earthquake, I didn't even hear about that. I want to bring this up because I think that we need to understand where the conversation is going in terms of climate change. Honestly, like, out of all the solutions we could be talking about, 8.2 magnitude, yikes. Out of all the solutions that we could be talking about, we're talking about attempting to refreeze the Arctic. The idea being that the Arctic is obviously melting at a much faster rate than the rest of the planet, and it is it does have a huge impact on climate change, and it is incredibly key to understanding climate change, right? But the problem with this is I don't want this to become this cartoonish this your whatchamacallit?
Oh, did my camera go out?
Yeah, I don't want this cartoonish like process become like the talking point. Like, I honestly don't think we are in the position to be talking about something like this, right? The best thing that we should be talking about in terms of solving climate change would ideally be addressing, hey, Dark Knight, we can just drop ice cubes on it. Yeah, like, this is, like, cartoonish. What we should be focusing is on the actual problems that are causing climate change, and the solutions have to include methods of addressing that. In fact, the overwhelming amount of scientists, climate scientists particularly, are saying that their prescriptions for this is to get off fossil fuels as quickly as possible in as many ways as possible, and just get off fossil fuels, and to understand that we need to pour resources into restoring destroyed ecosystems that keep us alive. Our economy and priorities have to be reassessed, and yeah, we should do what we can to also cut down on meat, and what we're in as quickly as possible in as many ways as possible. But this idea of effectively what Darkman was saying, just like, oh yeah, just put ice cubes on it, right? Like, we'll just dump ice cubes. We'll just try to refreeze the Arctic. Is not. I'm not hearing we're getting off fossil fuels, right? Like, I mean, that still doesn't address what's been destroying our forests and other ecosystems. Our oceans are dying. I don't know. This seems very bad. And I don't want people to get misled or misunderstand how we need to be addressing this issue. It's not just as easy as that, proud CIA asset. I think that there's a lot more pieces to that puzzle, although I wouldn't necessarily be against. I wouldn't be against making sure that we subsidize all these renewables. I wouldn't be against that. No, I'm specifically talking about beef. Sorry if I didn't make that clarification. The big beef industry has gotten to the point where they're literally destroying not only like important land, but also creating a lot of pollution, and also creating a lot of health problems, and also, of course, the cows themselves. But specifically, I think out of all of them, the beef would be the worst one. All animal agriculture is bad. Yes, in the commercial big farm sense, yes, I agree with Darknet. The counter argument is that when we start getting off fossil fuel, things will get more expensive and complex, and China will use their cheap and dirty coal to build the economy and speed pass against us. I'm not sure that that's the case. I believe China's attempting to make strides in renewables, I think. So I'm not sure if that's the case. And if we want to be clear, in terms of like production and economy, they're already flying past us, of course. They've got massive amounts of manpower and resources, so yeah. I think that, and Darknet, can you like, can you confirm that? Like, the problem is the massive commercialized animal agriculture, right? That's the problem. If we took away all subsidies, the oil companies would have a ton of money for renewables. I think, I don't know if that's what it would translate to, but I think that we should take away subsidies from oil companies. I think that we're just not listening. Okay, that's fine. China's making great strides. Yeah, my point being is I think they are already doing that, so I don't know. They're gonna beat us at that too. Just really quickly. A new report from Climate Crisis Advisory Group calls the Arctic a ground zero for cascading climate impacts across the planet, warning that rapid warming and melting there is likely a major trigger for disastrous changes to our weather systems. So the point being is, yes, it is important to acknowledge just how serious the melting of these ice caps are, the ramifications of what this means, but the solution isn't figuring out how we refreeze it, or how we like spend so much energy trying to figure out how this would even work, instead of just going towards the root of the problem, which is overwhelmingly the fossil fuel industry, and I would say even big farms, right? Commercialized farming. That's what we should be addressing. We have to start somewhere. True. Like, the reality is, we've got time on the clock is running out, and there's just no if, and, or buts about it. It has to be addressed. There are real consequences, and it's here, it's now, and we have to do everything we can within the time that we have, within the tools that we have, to do what is necessary to try to mitigate and adapt to this, because it's coming, whether we like it or not, and the Earth will be fine long after we're gone. So it's just a matter of whether or not we want to address this problem. And we have to admit, part of it is big commercialized animal agriculture. Like, I mean, the massive amount of waste, pollution is real. Deforestation and ocean pollution are serious factors too. Absolutely. Absolutely. But like, the solution isn't to deflect and say, well, don't worry, we'll figure out how to like make technology to refreeze the Arctic. I don't know. Not buying this type of narrative.
What's the matter, Oreo?
Oreo.
Got a little sugar puppy here, guys.
Is she in the room?
Yeah, hold on. I'm gonna turn the camera around. Sugar baby.
Animal agriculture is the leading cause of global warming, habitat destruction, soil erosion, ocean dead zones, and the list goes on. Jesus Christ. Well, I mean, yeah, ocean dead zones are due to commercialized fishing and the overfishing, overstressing our ocean food supplies, the fish supplies, which are also causing immense problems. The fact that so many destruction of land to do this is a problem.
Guys, I gotta head down to the hospital so I can pick Ed up.
Okay.
Now. If you guys are still on when I get back, I will hop back on. So try and hang out for me.
All right, don't worry. Either way, I'm just glad that you are okay. Well, at least on the uptick. At least that it seems like you are on the up and up.
Yep.
And
I'm gonna bring Oreo to surprise him.
And And hopefully next week, you'll be back full time again.
I hope. I mean, I'm gonna be recovering for months, but
No, I
we'll
mean
see.
like, like at least to be able to hang out with us a little bit on Saturdays, yeah. Because
Of
like,
course. I'm gonna try and come back on today as long as Carlos doesn't bitch out before I get back.
well, that depends on the time. Because yeah,
I'll
it's
probably
already
be back
3.
in a half hour.
I'll try to hang in there. It's already 3.
Probably be back in about 30 minutes. It's only about, or 30 to 40 minutes. It's about 15 to 20 minutes from the house.
All right, we'll see.
But alright, guys, I am glad to have seen you, even if it was only for a little while.
True.
Hopefully I'll talk to you guys a little bit more when I get back. If not, been thinking about y'all, and hope everybody stays good out there.
See ya. Dab out. How'd the call go? Can I give it like a medium face? I'll give it a medium face. Other. I'll give it a medium face. Hey Chai, how's it going? People sad. You just got here as the co-host was leaving. I gotta make the other overlay. I gotta figure out how I'm gonna do that. So yeah, the TLDR is this isn't focusing on the root of the problem. This is incredibly frustrating. That this is where the media is choosing to focus its attention, and instead of being like, hey, you know what? Maybe we need to get off. I think like even those 14,000 scientists, Darknet. To your point, I think these 14. There's an article that spread it forward. I think. And myself were going over where they said that one of the things that we should be moving towards is attempting to go as vegan diets as possible. Just cut it out, simply because of the massive amount of habitat destruction, as you said, agriculture runoff to host these animals. And the runoff that gets into the water, so on and so forth, which creates problems with algae, all of this stuff. Don't attempt, just do it. Yeah, absolutely. Do what you, I mean, like, I would argue, of course, if you can, just do it. Because it is important, and the more people get on board with that, maybe promote the healthiness of what would the healthiness of what a vegan diet would entail. Continuously drop those PSA announcement. Hey, it's actually pretty good for you. And not only that, you can save money X, Y, and Z. You can save money. It's easier, so on and so forth. Like, you could just try to like get people to understand this. From as many angles as you can. I mean, I myself do. So far, I've gotten like rid of. I think like I've gotten rid of like a good huge chunk of meats. And I keep working on it. Right. At this point, I don't even eat beef as much. Like, it's incredibly rare for me. And I don't do milk. Cheeses, I mean, it's important that we understand, right? Closer to climate change and pollution would be to take away the population of the planet down to pre-industrial revolution size. Yikes, what does that mean? Because, like, I don't know. I feel like that has nothing to do with anything. What is that? What does that mean? Because that sounds incredibly yikesy. I mean, yes, that's true. Darknet. There are options, meatless options. Yes. Do you think that Morningstar is a good brand? So I can't say much. Okay. Because I used to eat a lot of that. I used to eat a lot of Morningstar. Yeah, Petri dish logic. Yeah, I was trying to see what they were going to respond, but clearly we know where that could have gone. No. So population size has at this point gone off a cliff. So I think that what I mean is birth rates, I think across the board have gone off the cliff. So no, that's a non-argument. Try tempeh. It's really good in sandwiches and it's cheap and full of protein. What is tempeh? Hold on, we can Google this. Is that a brand? Oh, plant-based. Okay, gotcha. It's a plant-based a protein, kind of like an alternative to tofu. Oh, it tastes like chicken? Oh, now that is... Huh. Well... Tempeh bacon? Huh. With some buffalo sauce. From cooked fermented soybeans. Huh. Yep, just like you said. Fascinating. I think that this is I'm smelling it in my head. I haven't eaten bacon. Oh god. And then now I'm smelling it in my head. You can just replace with meat stuff with stuff like this so easily. Yeah, I mean, I used to go really hard on like on meat alternatives. Particularly, I used to eat a lot of Morningstar, which I don't know if that's good or bad, but it tasted good. Hmm. Mm-mm. Feet. Hey, Ella. That looks so yummy. I'm smelling it in my head. What about electronic production that generates a lot more carbon footprint than agriculture? Actually, I'm not sure if that's true. No, not who. What? Actually, meat in particular is an issue. Food is a major contributor to carbon footprints, and meat in particular is an issue. Livestock is responsible for a significant amount of greenhouse gas emission, and beef is one of the biggest contributors. So yeah, yep. Lab-grown meat is the future. Now, that is something. Yikes. Yikes, Ella. Jesus. Do they just sell this stuff in stores? I mean, no, beef and it felt like it should be banned, but chicken and goat should contribute to lab-grown. Should continue also, lab-grown meat lacks nutrition and is worse. I don't know. I'd have to see studies on that. I'd have to see studies. Jesus Christ. This is true. This is easy. Easy clap. Livestock is responsible for 65% of all human-related emissions of nitrous oxide, a greenhouse gas with 296 times the global warming protection of carbon dioxide. Oof. US methane emissions from livestock and natural gas are nearly equal. Yikes. Yeah, so yeah, so definitely issues are here. I need to be something not going to be interesting because we have plant protein. Yeah, true. As we're seeing, the real problem always comes back to the energy grid. Well, that's one of the things. Hambless, that's one of the things. Ideally, we would want to. Ideally, we would want to come off fossil fuels in as many ways as possible, as quickly as possible. Now. So yes, that is one of the major things that we need to do. And as I was saying before I got completely sidetracked, in that article, in that study that we were reviewing the other day that me and Spread It Forward posted of about 14,000 scientists, one of their prescriptions was to go vegan, right? Or was to, yeah, go vegan. And also addressed the necessity to pour resources into restoring ecosystems getting off fossil fuels, and reorganizing our priority when it comes to the economy and how we handle things like that. I mean, we could bring it up. But meat is freedom. Don't mess with my freedoms. They're coming for the hamburgers, guys. Are you trying to take away my hamburgers? True. And I'm obviously not going to tell people to eat plant-based or flexitarian when it goes against my morals. Gotcha. Plant-based diet. Okay. Stop fossil fuels. However, fossil fuels raise massive national tax revenue. Should we all have to pay for much more for other things? I'm not sold on that either. I'm not sold on that either. No, this isn't the article. This is one of the articles. I'm gonna have to go back up here. Hold on, folks. Have you seen the fires in Turkey? No, it's so hard to keep up with all the natural disasters that are happening. I can't even keep up. There's like fires everywhere. I need to find out where this is. Mm-hmm. To accomplish this task, the team suggested a three-pronged near-term: implement significant global carbon prices to reduce emissions, phase out and eventually ban fossil fuels, restore and protect key carbon-rich ecosystems like forests and wetlands to preserve the largest carbon sinks and protect biodiversity. Yeah, that's basically what they were prescribing for the immediate actions. The stuff that, you know, we can do now, which is getting rid of fossil fuels, so on and so forth. We have air quality alerts again because of fires in northern Ontario. Jesus Christ. I think we're gonna have to move to Mars. That's not feasible. We don't have that ability. This is all we got. This is all we got. Yeah, I'm not sold. Fifth dimension. Lord Elon of Mars. He can't even make it to like the upper atmosphere, past the upper atmosphere. So no. There'd be no such thing. Not with any current technology. No matter how much billions you put into it, is going to make Mars habitable in this point in time. With the current, with our current abilities, Mars is not currently habitable. So yeah, let's start by like making Earth habitable instead of worrying about like making Mars habitable. Anyways, so the TLDR, actually, let's take a listen. Is that we're going nowhere with this. This is a non-solution. This is incredibly frustrating because like it's so frustrating that we can't talk about like the serious in terms of like our leaders, our politicians cannot talk about even the idea of saying we need to take aggressive action with this, and part of that is going to have to come to terms with the way we do society and the way we have our economic systems, the way we have our dependence on fossil fuels, attempt for people to go to plant-based diets. I mean, like, not one has seriously been very, very adamant.
Minimize the damage. It's not the last trend.
Known, very respected climate scientist, John Kerry.
Chance for survival, but it is the last chance to minimize the damages and the changes on planet Earth. Rich countries will find a way to, and this is only going to accentuate the great divide on the planet today between haves and have-nots, wealthy nations versus developing nations, because they're going to feel it the worst. The developing nations, poor people, are going to get hit the hardest if we don't move.
Yes, but yes, but also it doesn't matter. At some point, climate change comes for all, rich or poor. But yes, it is true that they will be hit first and they will be hit the hardest. I still don't understand why this guy's in charge. Me neither, to be honest, at this point. Like, okay.
I spoke recently with one of the top scientists in the world, and I said, what worries you the most, Ed? Is from the evidence you see? And he said, what worries me is that we're beyond several tipping points.
Yes. True. We are beyond several tipping points that are going to cause a lot of domino effects, and it's going to be catastrophic if we continue down this path. At this point, we need to take aggressive measures to mitigate this and to begin to come to terms with adaptation and mitigation. That's it. That's right. Sell your homes to who, Ben? Aquaman? That's right. It does blow my mind how there's so many people with children who seem to just not really care because they're not seeing the bigger picture. They're not understanding the ramifications of what this has. Mostly because, well, a lot of astroturfing from not only big agriculture, big farming, big oil, have all told us that everything is fine. We have absolutely nothing to worry about. It's not us doing it. And if it is, actually it's your fault and you should recycle it more or don't be a litter bug or something. You know, that's why. Ella, that's why. The only option at this point, unfortunately, is going to have to be aggressive mitigation and adaptation policies by the government. That's it. There's not much else that will sufficiently begin to address it, right? Like Tasmania become carbon neutral in the next 2 years ahead of schedule. Yeah, anything with that like that should be completely at the forefront. I think having kids, your world is smaller as it should, but as a side effect, many people become more conservative because of the fears. Yeah, but like here's a really massive fear. Imagine leaving your kids a planet that is on the brink of like catastrophe. How's that for fear? Have you seen the Extinction Rebellion? I don't know if they're just a UK thing. Yes, I believe they are just a UK thing. Like I don't get it. Like if you become more conservative and more susceptible to like fear, for fear tactics, like what more fear than leaving your child, leaving your kids, which at this point, if you have like young kids, these will be the folks bearing the brunt of this. Leaving the planet for them in at the point of catastrophe. Like as they are growing up into like what middle adults or whatnot, that's when all that stuff is going to really be kicking hard, right? There's no going back if that happens. Once those tipping points begin to cascade, there's no going back. There's no respawn. There's no do-overs. This isn't a game. There's no planet B. Like, I mean, I don't know how else like fear do you need than that. Like, you would think it would make people more conscious, but they're global now? I have not seen any here. But yeah, instead we're talking about like, I don't know, nonsense like culture war BS. What can we all do to help the planet? The best thing that we can do, save your individual actions, because like, you know, obviously it's good as an individual to do your part, to obviously reduce your consumption and your effectively human carbon print, plant-based diet. Try to put yourself in a position where you do less as little emissions as possible as an individual person. But the reality is that's not just all we need. Get involved in local politics. Pay attention to like what's happening in the city councils and any if your state allows it, any type of like referendums or ballot initiatives and stuff like that. Get involved in local politics. We went over a story the other day where a county in Washington is banning any new fossil fuel infrastructure from being built. So they're no longer going to be building any type of fossil fuel infrastructure for energy. I mean, like, this is a city council that voted to do that. So local politics is important, and speak to everybody and anybody about the importance of this, and try to build awareness, because it has to be a massive effort to put political pressure to get anybody to do anything here in Congress or in leadership. It's not a fear they can easily grasp, it seems, sadly, especially with the haze of political rhetoric. Right, we're all talking about like the culture war or whatever nonsense. Yeah, like, there are individual choices that you can do, but also understand that without the political will, without the political will, we can't like do any meaningful like aggressive policies, right? I mean, obviously everybody should be doing what they can as an individual, do any type of like choices. Obviously, vote with your dollars where you can. Produce as little emissions as possible, plant-based diets, electric modes of transportation if you have the ability, or if your job gives you the option of working from home, do so. These are things that you can do, but participate, get involved, get involved in local, state, and politics, and pay attention to what type of bills and stuff are coming up, ballot referendums. Maybe build momentum for a ballot initiative to ban to ban fossil fuels in your area. Every empire has sown the seeds of its own destruction. The Western Civilization Empire will go the same way. Boris Johnson just announced that he's having another baby. So surely he wants to change things on a global scale for the sake of his own children. Lamau, no. I feel like he doesn't care. Although I may be wrong, but from what I understand. Wasn't the United Kingdom like about to open up new coal mines? You would think he would care, but I'm not sure. Do you think he generally doesn't believe in the severity of it? I don't know. I'm not inside his head. But policies, policy-wise, rhetoric-wise, doesn't seem like he cares. I can't get into people's heads, but the outcomes of the policies he's advocating for, or lack thereof, the consequences of that, the fallout of that is the same. I know that a lot of people say climate change is natural and it just happens and will kind of solve itself. And those people would be completely misled. And those people are completely misled. A lot of these talking points are perpetuated by big oil and gas. We have people like this. We have people like this literally trying to perpetuate that narrative. It's just normal. It's just the sun. It's solar activity. Natural warming. It's just natural. It's just natural. Help us stop dangerous CO2 reduction policies. Geothermal for Alberta? A case for caution. Let's dive into this. Myths and facts. Common misconceptions about global warming. Myth 1. Global temperatures are rising at a rapid, unprecedented rate. There has been no catastrophic warming recorded. Really? Okay, this one's beyond memes. This one is beyond memes. CO2 is the most common greenhouse gas. Yeah. But that's just objectively true. Human-produced carbon dioxide has increased over the last 100 years, adding to the greenhouse effects, thus causing most of the Earth's warming over the last 100 years. Yeah, true. We actually had scientists think about this back in over 100 years ago, actually. And here they're trying to deflect and confuse and muddy the water by saying, well, actually, we don't really know. I mean, sometimes it happens for various reasons. Yeah, sure, it's human and otherwise. It's just, it's not a big deal. Here they're trying to argue that the sun has the sun is the major cause of temperature variation on the Earth's surface. Yeah. Okay. To this present day, there's still no scientific proof that man-made CO2 causes significant global warming. What? No, that's just objectively not true. We know that CO2, like anyone who's taken like a basic basic class in biology would have learned that like that's literally what happens. CO2 is a greenhouse gas. There's a reason why CO2, methane, and these other nitrogen something is called greenhouse gases. Do you know how a greenhouse works? Myth: CO2 is a pollutant. Oh, this just gets better and better, folks. This is absolutely not true. Nitrogen forms 80% of our atmosphere. We could not live in 100% nitrogen either. Carbon dioxide is no more pollutant than nitrogen is. Wait, what leap in logic is this? Wait. What leap in logic is this? And then here, they are advocating for more CO2. Increases CO2 fertilization, actually increases the value of crop production between now and 2050 by an additional 11 trillion. Wait. Let me show you the increased CO2. What the increase in CO2 does to our crops. Yeah. No, this amount of CO2 in this little time is indeed a bad. Okay, this is what happens. You want another one? Basic chemistry and physics has shown much energy is trapped in the atmosphere as greenhouse gases increase, right? And one of those greenhouse gases is CO2, and therefore it's bad. That's how we got here. Myth number 8. Global warming will cause more storms and otherwise weather extremes. Hey folks, has anybody like kept track of all the wild, erratic, extreme weather events? We've had fires across the Pacific Northwest. We had fires, as someone pointed out, in Taiwan, I think. Fires in Siberia. We've had huge active hurricane seasons last year. We've had massive flooding in Europe, massive flooding in Asia, in China a couple of weeks ago. Or was it? Yeah, a couple of weeks ago. Yeah. This didn't just materialize out of nowhere. Australia is currently on fire. I mean, receding glaciers and calving of ice shelves are proof of man-made global warming. Yes, because of the rate of their decline is because it's exacerbated by anthropogenic global warming. Glaciers have been receding and growing cyclically for hundreds of years. Yes, but now they're receding at a unprecedented event due to the fact that the planet is warming, and these areas are warming at an even faster rate than the rest of the planet. And when that goes, I mean, it's a really bad deal, because not only will those glaciers not be there to reflect sunlight, which will further heat the planet, but all that ice makes sea level rise, so on and so forth. I mean, this isn't like that hard to understand. Yeah, and here's the meme that is, oh, it's just normal. None of this is abnormal. Mm. Mm-mm-mm. 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 Interesting. DeFreitas was a speaker at the Heartland Institute's 4th International Conference on Climate Change in Chicago. DSMOG has done research on the co-sponsors of the conference and found that 19 of the 65, including Heartland himself, has received over a total of $40 billion in funding since 1985 from ExxonMobil, Koch Industries, and family foundations, or the Scaife Family Foundation. Since 1985, from ExxonMobil. Now, wasn't that around the time that ExxonMobil had like this whole kerfuffle with them hiding information about climate change? Interesting. And these are the guys that they cite. There's a lot of profits to be made from climate change, like insurance and construction. Those industries will want more warming. I don't know. I would say that insurance in particular would want less, because that means a lot of claims will be paid out from all the destruction. So I'm not sure about that. Maybe construction? I don't know. Yeah, so the reason why we're having so much trouble getting people to understand the severity is because there are organizations like this perpetuating outright misinformation in a cloak of science, and this is just one of many. Most of these organizations are backed by fossil fuels, and most of these organizations are backed by fossil fuels or of some kind, or big animal farm, big agriculture, all of this stuff. They just put up the premiums, they always win. Not really. I live in Florida. Insurers that are swimming in red ink are cutting back coverage in certain geographic areas to shore up their finances. They're not doing okay. They had to pay out generated claims with an estimated about 30 billion, at least here. So yeah, I don't know. The consequences of that is that they are raising premiums. Hey, Skiddeer. The consequences of that is that they're raising premiums, but the reality is climate change completely messes them up. Here it is. The industry is in a panic because it's losing so much. Yeah, so no, I don't believe that that is true. I think that the insurance companies are freaking out. Florida slowly is, yeah, it is. Well, give it a couple decades. And give it by check back with us in 2040. See if we're still here. Yeah, by 2040, check back with us and see if we're still here. Right? If only we could find the fine folks of this lost city of Atlantis, so we can sell them all this fine real estate. Yeah, the next insurance bill to shore up all these losses are going to be increased, I imagine. I'm not a homeowner, but my parents are, so I imagine that's going to go up. Or they're just going to get dropped. They're just going to stop insuring people because it's just way too expensive and move out. And then what? Y'all don't realize what that's going to be as well. Like, people fail to understand. It's like climate change is so much more. It's just so much more. Florida will last more than 40 years, I say 2000. Well, it just depends. Really. Failure to act and mitigate will make that 2000 years not so much. I don't believe that. I believe that the way ice is melting and sea level rise is coming, and nothing being done, save raise a small, meager seawall, Florida's gonna be under in a couple decades. I say it's not this ephemeral. It's not this ephemeral 2000 year thing. We don't have 2000 years. That's not true. It's a lot less than that. But you will get hurricanes, yeah. That's also a problem, which will be exacerbated by climate change. There's going to be more of them, and those hurricanes that do come are going to be stronger, and will destroy more property and more, create more death. I mean, I don't know how else to like get it, ram it home. You know, this is a problem, and there's going to be a lot of human suffering. And I personally prefer to avoid human suffering, and I want to do the most amount of good for the most amount of people. So therefore, I believe, and based on science, that we need to aggressively attack this. I mean, there's just no other solution. No other viable solution, right? Listen to the scientists. Listen to what they've been saying for decades. And go from there. This is so frustrating. To lighten the mood a little bit. Maybe. Or gas boilers and go to electric vehicles? Gas boilers to electric vehicles, are those the same? Yeah, I don't think a gas boiler goes to a vehicle. But we should be moving away from fossil fuels in every way, shape, or form as quickly as possible. I'm gonna drop that link there. And unfortunately it is 4 o'clock, so I do have to get going, folks. I do appreciate I would say that instead of saying I understand that, but instead, how about we say there's massive profit in there's massive opportunities in changing industries and building the future. I would much prefer to just use to take that direction instead, right? There's massive opportunities in building the future. How about that? How about that one? There's massive opportunities in building the future. Alright folks, unfortunately that is all the time I have today. I want to thank every single one of you guys for hanging out this Saturday, Caturday. I appreciate all of you guys' support. You guys are what makes this channel grow. Don't forget, if you enjoy the content, make sure you hit that follow button. Do us a favor, go on the YouTubes, hit that subscribe button, follow, share, like, comment, do all that awesome stuff. Follow us on all the social medias, the Bird app, the TikTok, where we're hipping and hopping. As always, I appreciate you guys. Thank you guys for showing support to the co-host, and I'm glad that, you know, we're able to tell you guys a little bit of an update as to what was happening. Thank you guys, I appreciate it, and we really can't do this without you guys. You guys are what makes the show grow. Don't forget, folks, spread the word far and wide that this is the chillest place to be for news and politics. As always, I appreciate you guys for being here. Thank you. Please stay safe. Please take care of each other. As always, I love you all, and I hope to see you guys in the next stream. See ya! Thank you, Dark Knight. I appreciate you hanging out in chat and dropping some knowledge. Thanks for the stream. Bye, everyone. Thank you, Memies. I appreciate you. Sorry we didn't have as many kitty cats, but we had a few. We had Pip the cat and cute pictures, alright? Alright, hang tight with us, folks. I think we're gonna head to Tina. Oh. Okay, hold on, folks. Hold on, folks. Baby. Baby. Look at this cute kitty. I told you, there's always 100% chance there will be some type of kitty cat on stream. Hey, no comment check. Alright, folks. Hang tight with us. Sorry about that. I had to, we couldn't go without that, right? We couldn't go without that. Alright, folks, we're heading out in 5, 4, 3, 2, 1. Here we go.